Shoulder rehabilitation is an important component of the treatment plan following a shoulder injury. The rehabilitation allows you, the patient, to restore your shoulder's normal function, allowing you to live a more active and healthy lifestyle. This video will demonstrate a rotator cuff and shoulder conditioning program, and can be followed by anyone who has had an injury to their shoulder or rotator cuff muscles. The program can be tailored to each person's individual needs, and should ideally be followed under supervision of a doctor or physiotherapist. We will be focusing on exercises that improve the flexibility of the shoulder joint. This is important to restore your range of motion. Additionally, we will focus on exercises that strengthen the shoulder for more stability. Together, these exercises will help to reduce the occurrence of injury. Follow the program for 4 to 6 weeks. If you feel any pain when performing the exercises, consult a medical professional to ensure it's okay for you to continue performing the program and to ensure you're performing each exercise correctly. Before you start, you will need the following equipment: a light stick, approximately 30 centimeters at least in length, an elastic stretch band, and a set of light weights. 1 kilogram is usually best. If you do not have access to this equipment, you can improvise. For example, if you do not have weights, you can fill 2 500 ml bottles with sand. Instead of an elastic stretch band, you can use a pair of pantyhose. It is important to warm up the muscles before starting these exercises. This can be done by walking or cycling for 5 to 10 minutes. The pendulum. For this exercise, you will need no equipment. The pendulum works your deltoids, supraspinatus, infraspinatus, and subscapularis muscles. To perform the pendulum, lean forward and place one hand on a counter or table for support. Let your other arm hang freely at your side. Gently swing your arm forward and backward, repeating the exercise, moving your arm side to side, and then repeating again, moving it in a circular motion. Repeat this entire sequence with the other arms. For each arm, do 2 sets of 10. The crossover arm stretch. For this exercise, you will need no equipment. This exercise works your posterior deltoid. You will feel the stretch at the back of your shoulder. To perform the crossover arm stretch, relax your shoulders and gently pull one arm across your chest as far as possible, holding your arm at your upper arm. Hold the stretch for 30 seconds and then relax for 30 seconds. Repeat this with the other arm. For each side, repeat the exercise 4 times. Passive internal rotation. For this exercise, you will need a light stick. The exercise works your subscapularis, and you'll feel this by the stretch at the front of your shoulder. Hold a stick behind your back with one hand, and lightly grasp the other end of the stick with your other hand. Pull the stick horizontally as shown to you, so that your shoulder is passively stretched to the point of feeling a pull, but no pain. Hold for 30 seconds, and then relax for 30 seconds. Repeat this on the other side. For each arm, perform 4 repetitions. Passive external rotation. For this exercise, you will need a light stick. This exercise works your infraspinatus and your teres minor muscles. You will feel this stretch in the back of your shoulder. To perform the exercise, grasp the stick with one hand and cup the other end of the stick with the other. Keep the elbow of the shoulder you are stretching against the side of your body and push the stick horizontally as shown to the point of feeling a pull but no pain. Hold for 30 seconds and then relax for 30 seconds. Repeat this on the other arm. For each side, do 4 repetitions. Sleeper stretch. For this exercise, you will need no equipment. You will be working your infraspinatus and teres minor muscles and will feel the stretch in the outer upper back behind your shoulder. Lie on your side on a firm, flat surface with the affected shoulder under you and your arm bent as shown. You can place your head on a pillow for comfort if needed. Use your unaffected arm to push your arm down. Stop pressing down when you feel a stretch in the back of your affected shoulder. Hold the position for 30 seconds and then relax your arm for 30 seconds. Do 4 reps on each arm, 3 times a day. The standing row. For this exercise, you will need an elastic stretch band. The muscles worked are your middle and lower trapezius. You will feel this exercise at the back of your shoulder into your upper back. To perform the standing row, make a 3-foot-long loop with the elastic band and tie the ends together. Attach the loop to a doorknob or another stable object. Stand holding the band with your elbow bent at your side, as shown in the start position. Keep your arm close to your side and slowly pull your elbow straight back. Slowly return to the start position and repeat. Do 3 sets of 8 for each arm. External rotation with an arm abducted 90 degrees. For this exercise, you will need an elastic stretch band. The muscles worked are your infraspinatus and teres minor. You will feel the exercise at the back of your shoulder and into your upper back. To perform this exercise, make a 3-foot loop along the elastic band and tie the ends together. Attach the loop to a doorknob or stable object. Stand holding the band with your elbow bent 90 degrees and raise to shoulder height. Keeping your shoulder and elbow level, slowly raise your hand until it is in line with your head. Slowly return to the start position and repeat. Do 3 sets of 8. Internal rotation. For this exercise, you will need an elastic stretch band. This exercise works your pectoralis and your subscapularis muscles. You will feel the exercise in your chest and shoulder. To perform this exercise, make a 3-foot long loop with the elastic band and tie the ends together. Attach the loop to a doorknob or other stable object. Stand holding the band with your elbow bent and at your side. Keep your elbow close to your side and bring your arm across your body. Slowly return to the start position and repeat. Do this 8 times for 3 sets. External rotation. For this exercise, you will use an elastic stretch band. The exercise will work your infraspinatus, teres minor, and posterior deltoid, which will be felt in the back of your shoulder and upper back. To perform this exercise, make a 3-foot long loop with the elastic band and tie the ends together. Attach the loop to a doorknob or other stable object. Stand holding the band with your elbow bent and at your side. Keeping your elbow close to your side, slowly rotate your arm outward. Slowly return to the start position and repeat. Do 3 sets of 8 repetitions. Elbow flexion. For this exercise, you will need a dumbbell. The main muscle worked is your biceps, and you will feel this at the front of your upper arm. To perform elbow flexion, stand tall with your weight evenly distributed over both feet. Keep your elbow close to your side and slowly bring the weight up toward your shoulder as shown. Hold for 2 seconds and then slowly return to the starting position. Repeat 3 sets of 8. Elbow extension. For this exercise, you will need a dumbbell. The main muscle worked is your triceps, and you will feel this at the back of your upper arm. To perform this exercise, stand tall with your weight evenly distributed over both feet. Raise your arm and bend your elbow with the weight behind your head. Support your arm by placing the opposite hand on your upper arm. Slowly straighten your elbow and bring the weight overhead. Hold for 2 seconds before slowly returning back to the starting position. Repeat for 3 sets of 8 repetitions. Trapezius strengthening. For this exercise, you will need a dumbbell. The main muscles worked are your middle and posterior deltoid, your supraspinatus, and middle trapezius. This will be felt at the back of your shoulder and into your upper back. To perform this exercise, place your knee on a bench or chair and lean forward so that your hand reaches the bench and helps support your weight. Your other hand is at your side. Slowly raise your arm, rotating your hand to the thumbs up position and stopping when your hand is shoulder height, with your arm parallel to the floor. Slowly lower your arm to the original position to a count of 5. Repeat this on the other arm for 3 sets of 20. Scapular setting. For this exercise, you will need no equipment. The main muscles worked are your middle trapezius and serratus muscles. You will feel this exercise in your upper back at your shoulder blade. To perform this exercise, lie on your stomach with your arms by your side. Place a pillow under your forehead for comfort if required. Gently draw your shoulder blades together and down your back as far as possible. Ease about halfway off from this position and hold for 10 seconds. Relax and repeat 10 times. Scapular retraction and protraction. For this exercise, you will need a dumbbell. The main muscles worked are your middle trapezius and serratus muscles and will be felt at the upper back of your shoulder blade. To perform this exercise, lie on your stomach on a table or bed with your injured arm hanging over the side. Keep your elbows straight and lift the weight slowly by squeezing your shoulder blade toward the opposite side as far as possible. Return slowly to the starting position and repeat. Bent over horizontal abduction. For this exercise, you will need a dumbbell. The main muscles worked include your middle and lower trapezius, your infraspinatus, your teres minor, and your posterior deltoid. The exercise will be felt at the back of your shoulder and into your upper back. To perform this exercise, lie on your stomach on a table or bed with your injured arm hanging over the side. Keep your arm straight and slowly raise it up to eye level. Slowly lower it back to the starting position and repeat. Perform 3 sets of 8 repetitions. Internal and external rotation. For this exercise, you will need no equipment. Lie on your back on a flat surface. Extend your arms straight out from the shoulder and bend the elbow 90 degrees so your fingers are pointed upwards. Keeping your elbow bent and on the floor, slowly move your arm in the arc shown. Bring your elbow down to 45-degree angle if you experience pain at 90 degrees. Repeat this for 3 to 4 sets with 20 repetitions in each set. Weighted external rotation. For this exercise, you will need a dumbbell. The main muscles worked are your infraspinatus, teres minor, and posterior deltoid. To perform this exercise, lie on your side on a firm flat surface with your unaffected arm under you, cradling your head. Hold your injured arm against your side as shown, with your elbow bent at a 90-degree angle. Keep your elbow against your side and slowly rotate your arm at the shoulder, raising the weight to a vertical position. Slowly lower the weight back to a count of 5. Perform 2 sets of 10 repetitions. Weighted internal rotation. For this exercise, you will need a dumbbell. The main muscles worked are your subscapularis, your teres major. The stretch will be felt at the front of your shoulder. Lie on a firm flat surface on the side of the affected arm. Place a pillow or folded cloth under your head to keep your spine straight. Hold your injured arm against your side as shown, with your elbow bent at a 90-degree angle. Keep your elbow bent and against your body and slowly rotate your arm at the shoulder. Raise the weight to a vertical position. Slowly lower the weight back to the starting position. Perform 2 sets of 10 repetitions.